Acute abscess. Abscess is a localized suburative inflammation. What is the etiology of this condition? As any infection in our curriculum, the etiology of any infection should include 3 points: predisposing factor, route of infection, and organism. First of all, the predisposing factor for any infection is poor general health and poor immunity. Like poor general health as in senility, debility, malignancy, poor general resistance and poor general health, diabetes mellitus, lack of cleanliness, anemia. Immune deficiency sure occur in AIDS, or there may be immune deficiency due to drug intake like chemotherapy, immune suppressive drugs, or corticosteroids. What is the route of infection? How the organism enters this site? The organism enters this site to produce abscess, may be direct spread, local spread, lymphatic spread, blood spread. Direct spread through wound or ulcer, or through natural orifice. Natural orifice like lactiferous duct. Normal passage, the bacteria enter through the lactiferous duct to produce breast abscess, or through the parotid duct to produce parotid abscess. Infection may occur due to local spread of infection. Local spread of infection like breast abscess may occur as a complication of osteomyelitis of rib, and from osteomyelitis of rib locally spread of infection to the breast tissues. Blood spread of infection occur in any septic focus in the body, which produce bacteremia or biemia, and bacteria reach a distal organ to produce abscess like biemic liver abscess or biemic lung abscess. Lymphatic spread of infection. Lymphatic spread of infection, this is a famous method for infection. Scratch or abrasion or wound, and this scratch or infection or wound infected, and the bacteria pass in the lymph vessels to reach the draining lymph nodes, leading to acute abscess in the draining lymph nodes. And this is a very famous cause for axillary abscess. What is the organism responsible for this infection? Usually Staphylococci, Staphylococcus aureus especially, which secrete coagulase enzyme, which produce coagulative necrosis and subsequent pus formation. Biogenic organisms also occur, and biogenic organisms include Streptococci, Gonococci, Pneumococci, Meningococci, Escherichia coli, and B. brochus. All these organisms may produce localized suburative inflammation and abscess formation. Pathologically, the abscess consists of 3 zones. First of all, central zone. In the central zone there is coagulative necrosis and liquefaction of this coagulative necrosis by enzymes released from dead leukocytes, and pus is formed. Pus is formed of dead leukocytes dead and living microorganisms, necrotic tissues, and inflammatory exudate. This central zone is surrounded by intermediate zone. Intermediate zone formed of granulation tissue. This layer of granulation tissue represents a protective layer formed by the body to prevent more spread of bacteria and their toxins. Around this central area, there is a peripheral zone. This peripheral zone is formed of acute inflammation. What is the fate and complication of acute abscess? In the beginning of the condition, if there is good general resistance and proper treatment and early treatment before pus formation and the proper antibiotic, proper type and dose of the antibiotic, this leads to resolution of acute abscess. If the condition on the contrast is neglected, pointing and the rupture of the abscess, and this is the commonest sequelae, because the patient usually neglect the condition and pus reach on the surface. This is called pointing, and more neglected, leading to rupture, leading to ulcer or sinus on the skin discharging pus. The pus usually pass in the plane of least resistance until reach on the surface to point and rupture on the surface of the skin or inside the body on the surface of a mucous membrane or serous sac like the surface of the peritoneum or surface of the pleura. Spread of infection. Spread of infection may occur due to poor general condition. Generally, there is bacteremia, septicemia, viremia, and local spread of infection leading to lymphangitis, lymphadenitis, and cellulitis around the abscess. In some cases, if the treatment is inadequate drainage, inadequate antibiotic, this may lead to chronicity, chronic abscess. If there is abscess and there is pus formation, the only treatment is incision and drainage. If incision and drainage not done, and the patient take a proper high dose of antibiotic, and high dose, this leads to sterilization of pus. Pus becomes sterile and the pus never absorbed, and this pus remain forming a localized lump called antibioma. And antibioma is a memory for maluse of antibiotic, because this lump should be incised and draining the pus. If proper antibiotic, high dose of this antibiotic is given, this leading to a lump of sterile pus which never absorbed, leading to antibioma. This is important MCQ. What is antibioma? What is the difference between chronicity and antibioma? In chronicity, improper dose improper antibiotic is given, leading to change of acute inflammation to chronic inflammation. There is inflammation in chronic inflammation, but in antibioma, no infection, no microorganism, and remain a sterile pus. What is the clinical picture of acute abscess? We should divide the acute abscess into two stages: before suppuration and after suppuration. Before suppuration, as any infection, generally there is fahem, fever, anorexia, headache, malaise. Fever, anorexia, headache, malaise. Fahem. And sure, in presence of fever, there is associated tachycardia. Locally, abscess usually start as swelling, painful, tender, ill-defined, indurated. Why indurated? Because there is no pus formation yet, and there is congestion, edema, inflammation, leading to high pressure of tissues in this area, and the high pressure leading to indurated swelling. Pain is very important in this stage before suppuration. There is dull aching pain. Why? Because high pressure leading to compression of nerve endings in this area, leading to dull aching pain, in addition to tenderness. And this pain increase by movement and relieved by elevation of the part. Why? If there is inflammation in the palm of the hand, any movement leading to contraction of tendon and compression of the inflamed area, leading to more pain. And the pain is relieved by elevation of the affected part, because this decreases the pressure in the inflamed area. Why? Because elevation of the inflamed part leading to drainage of venous return, lymphatic drainage improvement of venous drainage and lymphatic drainage, leading to decrease of congestion, decrease of edema, decrease of high pressure in this area, leading to relief of pain. Sure, the inflamed area show redness and hotness. Why? Due to hyperemia. The inflammatory reaction and the reaction of the body to this infection is hyperemia, to bring more blood with more leukocytes, more antibiotic. Therefore, due to hyperemia, there is hotness and redness. Sure, there is edema, and sure, there is loss of function. The draining lymph nodes. Sure, bacteria pass in the lymphatics to the draining lymph nodes, leading to enlarged, tender, indurated, mobile draining lymph nodes. After suppuration, evidence of pus formation occur. After suppuration, the fever increase and becomes hectic. Increase by night and decrease by day. Why? Because by night you sleep, and due to congestion all over the body, congestion in the inflamed area leading to increased toxic absorption, and increased toxemia by night leading to elevation of temperature by night. This is called hectic fever. and the inflamed area becomes localized. The inflamed area becomes localized to a smaller area, because first there is diffuse inflammation, but once pus formation occurs, the infection becomes localized to a small area. Pain becomes throbbing pain. Why? Throbbing pain means pus under tension, and the surrounding vessels by pulse of the blood vessels will leading to exaggerated pain by every pulse. This is called throbbing pain. Edema becomes pitting edema, and this red area becomes yellow area, which means pointing. Pointing means that the pus becomes on the surface of the skin. Pus on the surface of the skin, therefore there is fluctuation. But sure, take care that pointing and fluctuation is a late presentation to superficial abscess, and usually denote destruction of the surrounding area. Therefore, never wait for fluctuation in case of breast abscess. If you wait for fluctuation, this leading to major destruction of the breast tissue and loss of function. Therefore, never wait for fluctuation in breast abscess, prostate, parotid. If you wait for fluctuation in parotid salivary gland, this may lead to facial paralysis. Perineum and perianal. If you wait for fluctuation, rupture may occur, leading to fistula. Hand infection. Never wait for fluctuation, because it denotes destruction of the area. Ludwig angina. Ludwig angina, which is submandibular diffuse inflammation and abscess formation in the submandibular region. In these areas, which start by B, breast, but also other are P's, prostate, parotid, perineum, perianal, and finally hand and Ludwig angina. In all these conditions, incision and drainage, once there is evidence of pus formation, which is throbbing pain and hectic fever. The earliest manifestation of pus formation is hectic fever and throbbing pain. What is the investigations needed for this patient? Sure, as any infection, blood picture show leukocytosis with shift to the left, and we all know that shift to the left is increase of immature leukocytes. Sure, culture and sensitivity for pus. Belen X-ray. Belen X-ray important for deep abscess. Ultrasound is important for deep abscess. CT scan is important for deep abscess, for presence of foreign body or affection of bone. Urine and the blood tests for recurrent infection. If there is recurrent infections in the body, we suspect diabetes mellitus, and sure, urine and the blood tests are essential. What is the treatment of acute abscess? The treatment of acute abscess, the video becomes very long, therefore we complete in the next video. Thank you for good listening and good luck.